Hi everyone, my name is Ang Li. I'm a currently second-year grad student in predictive analytics program in DePaul University. I'm very excited to interview one of my ask mentor, John Cursio, today, who is also a math alum from DePaul University. Hi, John, how are you?
Hi, Ang. Good to talk to you.
Are you ready? Can we get started?
We sure
can. My first question is, I know that you started your education in economics, obtaining both an undergrad and grad degree from UIC, but then pursue another master's degree in math from DePaul and PhD in biostatistics from UIC. My question is, what made your transition from economics to math?
Well, it was two reasons that caused me to transition from economics to math. One of them was encouragement from a fellow coworker. We were working at the same job, and for fun, we wanted to do another degree. So that's the first reason. Now, I chose the math, probability, and statistics track at DePaul because it gave me more marketability. At the time, I was thinking about changing a job, and so I pursued the mathematics degree at DePaul.
Wow. Okay. I know that you previously worked as biostatistician at Rush and UIC. And I remember when I first met you, actually have not heard of biostatistics as a career. So can you share with us more about biostatistics and how statistics is applied into another industry like healthcare?
Okay, that's a very good question. So biostatistics mainly is the research and application of statistics to health issues. And the one main application of that is looking at drug research. And the two types of statistical analyses that are appropriate for that are survival analysis. So people who say a drug company trying to market a firm, they want to make sure that subjects are not dying. So one of the ways to analyze the data is through survival analysis, which is a very classical technique for biostatistics. What a biostatistics degree also allows someone to pursue an industry job, both drug firms or hospitals, and they could stay in academia and pursue things like research grants if that's their interest as well.
I see. I think I remember like when I decided to switch my concentration from applied statistics to currently predictive analytics. I remember in one of our conversation that you tell me that the predictive analytics and big data is actually not necessarily new. Can you share more about that? What do you think is the same and what do you think is new and different?
Well, I may have misspoke when I said that, but I think the underlying theory and application is very similar to what is given to students in a statistics or a biostatistics background. Mm-hmm. So initially, the training is involved with getting clean data, knowing how to analyze it, knowing how to ask questions about the data, and knowing how to make insights about the data. Yes. I think what predictive analytics, what's exciting about it, from what little I know about it, is that it's going in all kinds of directions that weren't discovered or studied before. For instance, social media, there's a wealth of information that hasn't really been looked at with pure statistical methods. And one of my instructors had told us that really computer science and statistics are getting very close. And I think predictive analytics has grown out of that change maybe happening 10, 15 years ago.
Yes, and also I heard that since we have more and more data, do you think it's necessary that when data getting bigger and bigger, so the computer science gonna involve more and more? Since previously we have only this much of data, and we cannot if we don't have the computer science thing involved, do you think that's the reason?
Well, I think that's partly the reason. And given the nature of the game now, data can come from a lot of different sources. And what's important in a biostatistics or statistics or predictive analytics career is just knowing what the cutting edge is and using some new tools, using some graphics capabilities, using a lot of natural computer science type tools. So you're right, there is, it would be very hard, I think, to involve or study, say, big data without those computer science people in the forefront working with statistical people.
Mm-hmm. And that brings me actually another question. Since currently I think you know that the Kaggle data science competition getting more and more popular, and we use that kind of data in our class project a lot. So do you have any maybe experience in doing data analysis competition? Do you think is that a very good experience for students? Do you have any kind of advice for students?
Well, I can't speak to doing work with Kaggle competition, but I can speak to collaborative work in a classroom setting. And one of the classes I took at UIC while pursuing my biostatistics degree was a computational statistics course. And in there, the problems were tough. We had to work together as students. So I think that's something that the Kaggle will bring the best out in people, is that it takes a very hard problem. There's no
Right answer.
way to solve it, and using your innovative skills, your thinking skills with a very hard problem is what's needed in those type of competitions.
Yes, yes. And my next question is, if a student is very interested in a career like yours, what advice do you have for them as they launch their career? Are there any other skills or experience outside of statistics that you think very important to gain?
Well, that's a very good question. And what I would suggest is that early on in their career, before students look for a job, is to do a lot of networking. And that involves going to seminars, going to conferences, and learning from the experts, learning from the people who actually do that type of work. And the more you network, the more comfortable you get at it, and the more you learn, and the more you're able to be an expert yourself. So I think that's a skill that is not really formally taught in the classroom, but is very important to any individual going on to pursue a degree. The other thing I would say is just on the back of all of these careers, all of these majors, is really knowing your data. A lot of times in the classroom setting, the data's clean. It's not like that in the real world at all. You need to really understand where it came from, what are the components, how to work with it, what are the difficulties, so on and so forth.
Yes.
So those are the two pieces of advice I would provide to a prospective individual in biostatistics or statistics.
I know that currently you are working at University of Chicago Medicine, and for a senior statistical analyst. So can you share with us some maybe interesting research project?
Yes, I sure can. One of the projects I work on is involved with readmissions and trying to understand why patients are readmitted to the University of Chicago Medicine. And to do that, that involves understanding the patient population and a lot of regression, both logistic and regular linear regression. So that's something good to tell students that what you learn in the classroom in application. Another exciting project that happens every year is understanding of the U.S. News and World Report hospital rankings. So the University of Chicago Medicine is ranked in 12 different adult care specialties. And those rankings are watched very closely by the hospital leadership. And they want to understand and know what factors influence those rankings. So it could be things like the patient volume, the reputation of the hospital, and how sick are the patients, and those kind of factors do play a direct role into the regression model that I build once a year. And what's exciting about that is, number one, there is some pressure and a time crunch to get that done, but the end user end users are people like the chief medical officer, president of the hospital, and chief operations officer. So being in the thick of that kind of work is exciting, and knowing that ultimately the leadership will make decisions to improve patient care. So underlying a lot of the work, the modeling, is the excitement I feel in helping the leaders and everyone in the hospital improve patient care.
Very interesting. So for the regression you just mentioned, I know there are a lot of different regression. So after you just finish your first model, kind of regression model, would you also do something to improve your regression model?
Well, the approach I take is stepwise regression and looking for important predictors with the current year's rankings. Additional check, I take the current model and look at last year's model and see if we get similar results.
Oh, I see.
Kind of validation is going back, and then also prediction where things will be for the future.
So could you share with us that what do you think the most challenge aspect in your current research?
For me, the most challenging part of the job is that it's changing and it's undiscovered territory. So I'm kind of unique in that I'm formally trained as a PhD statistician, but in terms of a hospital doing quality analytics, there's not a lot of statisticians who are working in those areas. So for me, it's a lot of discovering where to go next. And I do have my managers to tell me what to do, but a lot of times there's a lot of planning, there's a lot of thought that will go into a project, which is not always what I'm used to. I'm more used to working much quicker at times.
Okay, I see. Thank you so much, John. Is there any other advice you think you need to mention beside that?
Well, one good piece of advice to add on to the networking is informational interviews. So it's not a bad idea to have an interview with an expert in predictive analytics or big data. That's just informational, learning about the job. It takes a lot of the pressure off of a formal interview. And I would suggest that do that as much as they can. And I'm willing to put my name out as a prospective person they could talk to if they're interested.
Thank you again, John. I really appreciate your sharing your experience with us, and also really appreciate and also want to thank you for being patient to answering all of my statistics questions through email whenever I email you. Thank you so much, and yeah.
Oh, that's you're welcome. You're very welcome. That's part of the pleasure of what the Ask Network does for not just the students, but what it does for me as a way to give out what I know to students.
Thank you. And also to students out there, I hope that you all enjoy John's experience and also to get a chance to speak with ex-mentor like John. Just visit ask.depot.edu for more information. Thank you again, John.
Okay, you're welcome.